Hi, folks. Welcome to Big Talk with Bruce Dickey here on Wabash Catch TV. Look who it is, the busiest person in town. It's Deena Mosbarger. How you doing, Deena?
I am good. A little tired, but I'm good.
A little tired,
I am good. I'm healthy.
That's exactly right. And look, we are practicing social distancing. How you like that? I feel really good about that. I'm very proud. I made some camera shifts this morning, so we'll be able to practice that extremely efficiently and safely, and we are going to have a good time today. As good a time as we can have, because we are going to be giving folks, well, I've already left the Clorox out that you can see there. Now, that's the right stuff, right?
That is good, and it should say on it that it is good for disinfecting the COVID virus.
Well, it may be a little bit too old to say that.
It's in the small print on the back.
Oh, is it? Thank you so much for telling me then that I'm looking good. I appreciate that. And by the way, before and after every guest, I am wiping all my surfaces down and doorknobs and stuff like that. So we're going to talk about all kinds of stuff. We are going to keep you healthy, hopefully. And Deena and I are going to talk about all that stuff. You are watching Big Talk with Bruce Dickey here on Wabash Catch TV. I'm Bruce Dickey. Thank you so much for tuning in today. Let me give you a little idea of what is going on around the area today. This is Tuesday, March 24th. Now, in actuality, we are recording this on Monday, the 23rd. So if any information that you have or that you might continue listening and watching your news, your favorite news source, or maybe not your favorite news source, because there are some out there that are not always correct. But pay attention to the news, and if you need any further information, Deena is always going to hop on the radio or back on here or anything like that.
Absolutely.
Right?
Absolutely. That's our job.
I heard you on the radio the other day. You did a great job and very informative.
Thank you. There's a lot of information floating out there, both fake news, both fake information and good information, so it is important.
I'm going to ask her about some of those fake stuff as we get on through the show, because I am really looking forward to throwing a hairdryer up my nose.
Oh, my. Oh, my. I haven't heard that one. That might be interesting.
You haven't heard that one yet? Oh, that's a good one. I'll tell you all about that. What's going on today? Not a ton. However, there are still a few things going on today, and one thing going on today here on Tuesday, March 24th. Let me give you an idea of what's canceled first, however. Here in Florida, they were planning on having screenings all week long from from today through the 26th, I believe, through Thursday. This was the unit number 35 preschool, as well as birth to 3-year-old screenings. They were going to be at the First Christian Church. Those are off. Do not take your children down there, as they are canceled due to the COVID-19 virus, as well as the quarantine orders that we are all under. Please watch for more information. I'll tell you when that's coming back. Also, in addition to that, the Regional Office of Education number 12 and the Buckaroos early education pre-K screenings were going to be at the Buckaroo Early Learning Center. They were going to be today as well. Those are off. And for more information, you can probably contact 544-2719 or 662-7237. They'll tell you when those are back on. Dr. Chung planned on having a short concert at the Flora Rehabilitation and Healthcare Center. That is off. It was going to be at 2 o'clock today. However, there is something still going on. The Helping Hands Food Pantry, they are going to be at the Gospel Lighthouse Church. That is in Odin today at 1004 East Poplar Street in Odin. Go ahead if you need to catch that. 1004 East Poplar Street in Odin. And due to the epidemic, they ask that all the folks coming by to pick up food, please remain in your vehicle, and they will distribute the food in prepared bags via drive-through distribution. So, and they don't need any volunteers today, so be patient with them throughout this situation. They're asking for your patience, but they're going to try to make sure that everybody who needs it gets some food, and that is very important at Odin. Again, that's at 10 a.m. this morning if you were planning on going to Odin to pick up some food. That is still on. Also today, Painting with Jan Ocean Waves is canceled. Bingo night at the Effingham KC Hall is canceled. I'm guessing that you're seeing everything in the world canceled, aren't you?
And that is most appropriate, except for our healthcare providers, of course, who are batting 150%.
Unbelievable.
They are really putting it out there. But yes, everything else, unless it is an essential service, should be canceled.
Yeah, that's exactly right. And, that's the thing. You say, Bruce, why are you still broadcasting? We're an essential service.
It is. It's very important to get the information out,
right.
Bruce, and I appreciate you doing that by holding this show.
Well, you didn't have to thank me yet. I would ask you for thanks later.
Maybe that's to be determined.
Yeah, you may not. That's exactly right. What else going on around the town today? Actually, this is now. I know you're going to have to do this at home, and it's probably not the easiest thing to do, especially since they have those nice seasoned grills. This is National Cheesesteak Day. March 24th not only celebrates a fantastic sandwich, but it recognizes one of the nation's greater debates who created this. Actually, it was created, I think, by Pat Oliveri from Philadelphia. Pat's King of Steaks sits on the original location, and it's still going strong. The cheesesteak there is outstanding. I've got a picture of a couple of cheesesteaks. Which one up there is your favorite cheesesteak sandwich? You've got there's kind of a problem there on the upper left. Man, I don't like the tomatoes. You don't want to put the tomatoes on a cheesesteak.
I'd have to go for the lower right, definitely.
You're going for the lower right?
Lower right. That kind of looks like good. Julian's or Anthony's.
Yeah, really, it does,
both of those are very good.
Outstanding. And if you take that lower left, they are, by all means, get your tater tots with it. That'll work, right? Tater tots with cheesesteak. You can't go wrong. National Cheesesteak Day, again, is celebrated March 24th every year, which may or may not coincide with the other one, celebrated on March 24th every year. Actually, this one is on the fourth Tuesday of March every year. It is American Diabetes Association Alert Day. You might not want the hoagie bun. How about that? The rest of the cheesesteak might be okay, you think, Deena? But
you need everything is good in moderation.
There you go. Moderation is the key at all times. Exactly right. Thank you so very much for saying that. American Diabetes Awareness Day is held this day on the fourth Tuesday of March every year. There are probably 10% of I think I read a statistic. Over 80 million, you can probably correct me if I'm wrong, over 80 million Americans have pre-diabetes symptoms, and 70 million don't realize it. Does that make
that does. I'm
right?
Not sure about the statistics, but that is accurate. On normal days, that is one of the health department's jobs, is to prevent illness and promote wellness, and diabetes has always been on the top of our list.
So I guess on a normal fourth Tuesday of March, you would have been trying to get the word out on diabetes today.
Absolutely,
then,
absolutely.
And that's it's just not today's not normal at all. Then is it?
It is not normal. It should be for eating, though, so I could go off on, being sure that you eat healthy and follow all of those things while you're staying at home. We'll tie it in.
We're going to tie it all in.
Tie it in.
We'll get it all tied in. What else going on today? Well, on Wabash today, we've got local sports coverage. Hopefully, that's the thought. We'll have repeats of some local games that we've had over the course of the year. I know we've been running them. We ran them all last week, ran a bunch of them last week. We have already, over the course of this school year, have already shown 70 different events with another 40 or 50 scheduled. Don't know if we'll be able to get them going, but we'll see. But that is all coming up here on Wabash Catch TV. Today, it's Big Talk with Bruce Dickey here on Wabash Catch TV. My guest is Deena Mosbarger. She is from the Clay County Health Department, and when we come back, we're going to get us all up to date. We're going to all figure out everything about COVID-19, right?
We will do our best.
I like that better. We'll be back right after this. Do stick around.
In 1949, Morton Buildings constructed our first machine storage building to establish our bond with the farming community. Since then, our relationship has grown, and so have our product offerings. From the smallest specialized operation to the largest agricultural enterprise, we understand the needs of your business and continue to evolve to meet industry demands. Plus, when you build a Morton building, you're backed by the strongest warranty in the business. To learn more about the Morton Advantage, visit mortonbuildings.com.
At Wabash Communications, our goal is simple: to keep people connected. And today we are doing just that, better than ever, by delivering the latest technology and personal service only a local provider can offer. We offer services anywhere from fast, reliable internet, TV services, and home monitoring solutions to crystal clear local and long-distance phone service. Wabash continues the commitment we started back in 1952, delivering a great connection to the most important people we know, our customers. So choose Wabash, the local service from people you can trust.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
Hi, my name is Bruce Dickey of Wabash Catch TV's Big Talk with Bruce Dickey. Watch us each weekday right here on your local cable station. We're on at 9 a.m. with a repeat at 9 p.m. It's your local TV talk show with plenty of information, fun, and frivolity to get your day started right or maybe even ended right. Please contact me at 665-9970 or at bruced@wabash.net if you are a member of your organization would like to be a guest on the show. That's 665-9970. Big Talk with Bruce Dickey. Hey, thanks for watching.
Get what you want and nothing else when you order a la carte internet from Wabash Communications. Wabash Communications is now able to offer a la carte internet called broadband only with fast download and upload speeds, reliable service, and unlimited data usage. No phone service is required for our broadband only plans. Our broadband only menu includes packages up to 1 gig download. Call us at 665-3311 now to order. Service availability and internet speed will depend on location. Contact us for details.
But
Okay. I'm not offended. I'm not. Email.
Well, welcome back, folks. You're watching Big Talk with Bruce Dickey here on Wabash Catch TV. Look who it is. It's Deena Mosbarger. She is from the Clay County Health Department. How long you been down at the Clay County Health Department now, Deena?
Since 2012.
2012. So where were you before that?
Excuse me, I've been there since 2002. Time flies.
You lost a decade.
I did. Wow. I was formerly with the Clay County Hospital. I started there in 1991,
Right.
and I moved out to the new facility. And shortly after that, in order to start our family, I took a job with the Clay County Health Department. Been there pretty much ever since. I had a short break.
And you've been in charge of the place for maybe since 12, right?
So Jeff Workman is actually our administrator.
Okay.
We oversee both Effingham and Clay County Health Departments. My role is to do whatever Jeff tells me to do.
Yeah.
Really, it's called Special Projects Director. And so in this role that I'm here today, my role is the Public Information Officer. So that includes educating the community on various health topics. Today it's COVID-19.
Tell me a little bit. Okay, we're going to basically spend the bulk of the show talking about the coronavirus. I had a screenshot of that black page. Have you seen? I guess you see the black page that has how many cases all over the world and all that kind of thing.
Yes, I think I know the one.
Do you look at that? Do you see that kind of thing every day, or is that something you try not to even think about?
I've been paying attention more to the Illinois Department of Public Health, watching where it is active in Illinois. In Illinois, because we know that it's around us, and I want to make people aware of how close it's getting. And where the cases are.
How close is it at this time?
So the closest county to us, I believe, is Cumberland.
Okay.
And
that's a new one then. That wasn't there.
Cumberland came up last week.
Yeah.
So that's just up near Effingham. It touches Effingham. And so that's the closest one. What we know, though, is that not all cases are going to be tested positive. So that map just shows the tested cases. We know it's circulating. A lot of folks likely don't know they even have it.
Yeah. All right, let's back up a little bit. Let's back up a little bit. Let's give folks who may never have heard the word, explain to them what COVID is. COVID means coronavirus disease, right?
Correct.
Okay.
Correct. And it has the 19 behind it because it was discovered in 2019.
Okay. All right. COVID-19. So we can keep all that in mind. Keep it coronavirus. There are other coronavirus
Viruses, I think is correct.
There are other coronaviruses as well. This one is just the probably, well, at this time, this is the one particular one that is causing the real problems. When did this first come onto your radar, this COVID-19?
I believe we first started receiving emails at the first of the year. It may have been the very end of December, but it definitely was on radar when we had our first 2 cases in the United States. Mm-hmm. And I believe that was mid-January. Mid-January,
and folks probably also started realizing it was whenever the cruise line.
Yes.
The cruise ship got held up.
Yes.
In Japan.
It was the cruise ship as well as the Chinese New Year.
Right.
Really brought that up because we're an international
country.
International country. And so a lot of folks traveling back to China and watching the Chinese news, seeing that the coronavirus was heavily circulating there, seeing all of the disease and a lot of deaths starting to be reported, and figuring out that it was a different virus.
Yeah, that was my thing. Whenever this flu, people think of the flu. It's not really an influenza, is it? Or is it an influenza? It's a virus, but not an influenza.
Correct. So in describing coronavirus, it's novel in that we haven't seen it before and we haven't figured out how long it lives or how to attack it. Where the flu, it does change every year. Mm-hmm.
But there are some constants with the flu.
There are some constants with the flu. The confusing part of coronavirus, I believe, is that it has symptoms that are very similar to the flu, with the high fever. What coronavirus does not have is body aches. Typically, the flu has body aches that go along with it. Coronavirus has high temperature, sore throat, and shortness of breath. Usually the flu will have some of those symptoms as it progresses if it's not taken care of. And we also have, of course, a vaccination for the flu.
Right.
And we have antivirals that are available if diagnosed early.
And the antivirus Tamiflu, for
exactly.
instance, is the one that you if you catch it in the first 2 or 3 days.
Yes.
That's the one. And for the novel coronavirus, the COVID-19, it's new, spanking new enough that we don't have any of those particular things.
That's accurate. Working on it quickly, but not yet.
These things take time.
Yes.
All right. And for that matter, working on vaccinations as well. But again, these things take a time. Okay, so about mid-February, they've held up the boat. They've held up the ship. You probably began thinking, oh, heavens, this is going to be it's a bigger deal than maybe we were hoping.
It has a lot of potential, and we have seen that in other countries. And as that's when we were monitoring things overseas. We watched it in China, and then as Italy and some of those other countries started seeing worse and worse cases, and then more cases coming to the U.S. and realizing, oh my, we do not have, as those other countries do not have the medical capacity to handle that many sick folks at once.
What is the main difference that folks need to know about this virus, and the reason that they need to stay in they might say, look, 60,000 people die of the flu every year or something like that. Why do I have to worry about this, Deena? What do you tell someone who asks you that?
Sure. We start letting them know when you hear the words flatten the curve.
Right.
Because the peaks of flu season tend to be a little flatter than this coronavirus. So if you can imagine, we have babies being born every day.
Sure.
Surgeries going on every
Absolutely.
day. Car accidents.
Donations of blood. And all of those things are being served by the medical capacity in our communities. The hospitals have enough beds, they have enough operating rooms, they have enough labor and delivery rooms. During flu season, it kind of comes slow, and then they start to occupy those beds. Only a few people get sick. With coronavirus, what we're seeing is that it spreads so quickly that the curve just jumps great big, and all of the needs happen at a time when there are no beds available, there are no ventilators, or you have to decide who is going to get to use them because there's not enough to go around. Yesterday, the president, in his speech, mentioned that he's added 2 of the ships to add capacity for medical beds. He also mentioned propping up FEMA hospitals in different locations. That's because there's not enough capacity to take care of the people who are getting sick all at once and need additional medical care. That was the surprising thing I saw in the news on Monday, on the 23rd, was they were moving, after the president said they were moving a Navy hospital ship, a naval hospital ship up to Los Angeles to handle non-COVID. It was basically, it was for the folks who do not have the virus. This was where everybody else is supposed to go. And I mean, and I tell you what, let's do. We're going to take a quick break, and whenever we come back, we're going to keep talking about how you can keep yourself healthy. We want to make sure that you know exactly what you're dealing with, but we want to make sure you're able to keep yourself healthy. That's Deena Mosbarger from the Clay County Health Department, and you're probably going to tell yourself you're hearing this enough, but until everybody starts doing it and taking care of their neighbor, you're probably going to hear a lot more of it. You're watching Big Talk with Bruce Dickey here on Wabash Catch TV. Deena and I'll be back right after this. Please stick around.
At Wabash Communications, our goal is simple: to keep people connected. And today we are doing just that, better than ever, by delivering the latest technology and personal service only a local provider can offer. We offer services anywhere from fast, reliable internet, TV services, and home monitoring solutions to crystal clear local and long-distance phone service. Wabash continues the commitment we started back in 1952, delivering a great connection to the most important people we know, our customers. So choose Wabash, the local service from people you can trust.
Looking to build a new hobby building, horse barn, or farm shop? Let Morton Buildings help you design and construct a building that perfectly suits your needs. We'll be there for you every step of the way, even post-construction, with the strongest non-prorated warranty in the industry. Plus, Morton's exclusive Energy Performer insulation system provides the ultimate in comfort and efficiency. To see our latest projects and learn more, please visit mortonbuildings.com.
Get what you want and nothing else when you order a la carte internet from Wabash Communications. Wabash Communications is now able to offer a la carte internet called broadband only with fast download and upload speeds, reliable service, and unlimited data usage. No phone service is required for our broadband only plans. Our broadband only menu includes packages up to 1 gig download. Call us at 665-3311 now to order. Service availability and internet speed will depend on location. Contact us for details.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Le Mans always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at lemansonline.com. You'll like the way we do business.
Hi, my name is Bruce Dickey of Wabash Catch TV's Big Talk with Bruce Dickey. Watch us each weekday right here on your local cable station. We're on at 9 a.m. with a repeat at 9 p.m. It's your local TV talk show with plenty of information, fun, and frivolity to get your day started right or maybe even ended right. Please contact me at 665-9970 or at bruced@wabash.net if you are a member of your organization would like to be a guest on the show. That's 665-9970. Big Talk with Bruce Dickey. Hey, thanks for watching. Hello, folks. Welcome back. Big Talk with Bruce Dickey here on Wabash Catch TV. Deena Mosbarger is here. She is from the Clay County Health Department. We've got all kinds of fancy stuff we're going to show you. Before we get to that, I guess I want to bang home, and I want to make sure that I'm banging home to folks the difference between this and the regular flu that comes every year. This is quite. Not only in that we don't know how to cure it, this is quite a little bit more severe than the regular flu, isn't it?
It is. The coronavirus is highly communicable, where the flu is communicable. This is even more so. Spreads a lot faster. A lot more people are going to get it. You don't know if you're carrying it.
It's a devious little bugger, if you want a little different term.
It is. So folks don't even know. That's why social distancing is so important, and people don't take it seriously enough. And that's kind of what we were talking on break, that this is serious, folks. Do you think the president would be getting on television every day to talk about it, or that it would warrant this kind of response if it was just the normal flu? This is a big deal. This is a big deal, and folks need to realize that this is a big deal. Now, when you we could throw numbers at folks, but it's not going to. Either they're going to believe you or not believe you. Right. And let's talk a little bit about social distancing. This is a new term that I suspect you've known for years. Yes. I have not. I had no idea what the term social distancing meant. What does that mean? Sure. That means that you should keep yourself at a safe distance, and we're talking 6 feet. Right. Between one another. Back in, I don't even remember what year it was, but under H1N1, we did a lot of 2009. We did a lot of education in the classrooms, even on pushing your desk farther away from your neighbor. And the reason they say 6 feet is when we talk, automatically there's a little for some of us with larger voices. There's a reason. If you ever see me at a game, there's a reason I'm always drinking water. There you go. Because I'm talking loud, and I'm losing moisture. If I'm losing moisture, it's probably carrying whatever I've got in me, right? Absolutely. And this is an airborne virus. We know that. And so 6 feet is what's recommended as a safe distance to keep you from catching some of those. The room's not big enough to actually push Deena farther away. As far, she needs 9 or 10 feet. That's why I'm not talking right at her. How about that? I'm just teasing. I will take my precautions. She's going to go back and wipe down with Clorox. Yeah, I don't blame you. Okay, social distancing. Not only is it 6 feet between people, this is also groups. Yes, this is when we hammer home the point. Stay at home. It is so important. At one point, we had numbers of people that we thought it was okay to get together with, and that got diminished further and further every day. We're telling you, folks, if you don't have to go anywhere, don't. It is time to stay home and only go out for those essential things. If you need to fill your prescription, go there, but if there's somebody in front of you, you stand way back.
Yeah.
But the best advice really is to stay home.
That's the most difficult thing to remember. One of the more difficult things to remember. I've spoken with my wife about this over the last few days. She did the grocery shopping, and we've got a full fridge. We didn't leave the house after Friday. We were just fine. However, she said, I didn't even think about it. I was standing there in line at the grocery store. I was right next to the fella in front of me, and and the gal behind me was right next to me. And you don't even think about it, but it does make some sense, doesn't it? And I mean, it all is a means to the same end, which is to stay healthy.
Exactly, and to slow any spread. Stay healthy, slow the spread so that if you do happen to get sick, we can manage it safely. What
do you tell the folks who say, I've been sick before, I can deal with this, or maybe they're not feeling well at the time or something, but they don't think that they'll come in contact with somebody else, or that maybe I guess folks may not realize how many substances or how many things they can have an effect on, do they?
They don't realize that.
And how many surfaces is what I mean.
Exactly. I think it's raised the awareness. I wonder how many folks have had difficulty not touching their face. That's another thing that we're recommending, that you make sure that you keep your hands away from your face, because there's a lot of places on your face where germs can enter your body. If nothing else, this has raised awareness to those individuals who say, I'm going to get over this. Maybe you can. Maybe you can't, but would you like to be the one who spreads it to the person who cannot?
That's exactly
get over it.
That's when you think of Rudy Gobert. I don't know, that's probably a name you would have never heard of. He's the first guy in the NBA who had it. He's the guy who licked his fingers after a press conference. He didn't think it was a big deal. Licked his fingers and wiped down and touched all the microphones in front of him. And then he tested positive for COVID-19 just hours later. And, of course, that means he'd had it for a longer period of time. And of course, not everybody's going to go out and lick microphones or do whatever, or lick tables, because you just don't do that. But you need to be cognizant of how you're living, because even while you might be young and healthy and strapping and burly, the next person may not.
Right.
And that's who you need to look out for, your fellow man here, right?
Exactly. It's not the time to be selfish. Think about those around you.
Exactly right. I tell you what we're going to do. We're going to debunk some of the myths maybe that you're seeing. We're going to tell you if you think you've got it, who you need to call. We're going to talk a little bit more about social distancing, and we're going to talk about all kinds of things. We're going to keep you healthy. You are watching Big Talk with Bruce Dickey here on Wabash Catch TV. I'll be back with Deena Mosbarger right after this word. Stick around.
At Wabash Communications, our goal is simple: to keep people connected. And today we are doing just that, better than ever, by delivering the latest technology and personal service only a local provider can offer. We offer services anywhere from fast, reliable internet, TV services, and home monitoring solutions to crystal clear local and long-distance phone service. Wabash continues the commitment we started back in 1952, delivering a great connection to the most important people we know, our customers. So choose Wabash, the local service from people you can trust.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
Hi, my name is Bruce Dickey of Wabash Catch TV's Big Talk with Bruce Dickey. Watch us each weekday right here on your local cable station. We're on at 9 a.m. with a repeat at 9 p.m. It's your local TV talk show with plenty of information, fun, and frivolity to get your day started right or maybe even ended right. Please contact me at 665-9970 or at bruced@wabash.net if you are a member of your organization would like to be a guest on the show. That's 665-9970. Big Talk with Bruce Dickey. Hey, thanks for watching.
In 1949, Morton Buildings constructed our first machine storage building to establish our bond with the farming community. Since then, our relationship has grown, and so have our product offerings. From the smallest specialized operation to the largest agricultural enterprise, we understand the needs of your business and continue to evolve to meet industry demands. Plus, when you build a Morton building, you're backed by the strongest warranty in the business. To learn more about the Morton Advantage, visit mortonbuildings.com.
Get what you want and nothing else when you order a la carte internet from Wabash Communications. Wabash Communications is now able to offer a la carte internet called broadband only with fast download and upload speeds, reliable service, and unlimited data usage. No phone service is required for our broadband only plans. Our broadband only menu includes packages up to 1 gig download. Call us at 665-3311 now to order. Service availability and internet speed will depend on location. Contact us for details.
Morning, folks. Welcome back. Big Talk with Bruce Dickey here on Wabash Catch TV. My guest today is Deena Mosbarger of the Clay County Health Department. We're going to tell you how to get a hold of them if you have any questions here in just a minute. And I'm certain you're getting bombarded from time to time with questions.
Plenty of phone calls. Happy to help. Also referring folks to our Facebook page and our website. As well as to the 800 number that's available through the Department of Public Health, and we'll hit on that.
The Illinois Department of
Yes.
Public Health. Okay.
Yes.
We were talking social distancing. I've got a nice little graphic here. Take a look at this one and tell me, can this be true? This really, and when you do the math, this is really true, isn't it?
It is true. And I love this graphic. We even used it on our Facebook page in the last week. And it shows, I love that at the very bottom, if you are just one person, you can reduce the spread significantly.
Now hold on a second. Okay, let's go back through this. I got rid of it. This just surprises me. If you infect 2.5 people, I guess this is considering each of those people can infect 2.5 people over the next several days.
Exactly. And that is the reason why it's so important to do social distancing. This is specific to, I believe this particular graphic, when I looked at it, was specific to the communicability or the spread, how quickly COVID-19 spreads. So it's pretty accurate.
We've got another document here that is a pretty good one. This is the social distancing. What does it mean? And things to avoid. Now, most of these things, like the things to avoid, are probably canceled. For instance, athletic events are canceled, concerts, theater outings, church services. However, folks probably, the kids aren't going to school. Are they having sleepovers and play dates and that kind of thing? You don't want to do that, do you?
You don't want to do that. It's initially when it came out and the guidance came out and the school was canceled, I did see a lot of students congregating in the skate park and at the basketball courts.
Yeah.
It's not the time for that.
No.
If you can play basketball at home, or make sure that you're doing those things alone.
Avoid visitors in your home. That makes sense. And non-essential workers in your home. I guess. Let me ask you the question then. If folks have the occasional man or woman or service that comes in once a week, to clean the house or help clean the house, Is that something that we need to rethink? And as a hypothetical guy, am I in trouble?
Yeah.
I'm going to get busted. Like she said, I'm going to have to meet my maker or something.
Right.
Something I need to think about, huh?
So that would be, I would consider that non-essential unless you really, if you have disease in your home, if you have had coronavirus in your home and you need assistance with cleaning, that becomes essential.
Yeah.
So I would hate to be the one to tell you when that is and when that isn't. We know essential workers that come into the home. We have homemakers that come in and help with meal preparation for our elderly. Our home health and hospice programs through the health department are still actively seeing patients. We're working on a process now where we can use our iPads to FaceTime with the physician, and they.
Oh, is that right?
Yes, and we're working through that. It's not available just yet. But we've had conversations over the weekend. We're talking to them yet this morning so that those services could be ordered and keep those who are not quite as ill in their home. And we're taking utmost infection control precautions so that we don't carry from one home to the next.
Right.
And so they'll be wearing some garb that may look kind of scary, but it's for your protection and for our employees.
Let me ask you this. I know some folks who they keep one of these in the car, for crying out loud. And every time they get in the car, they basically wipe down their all their stuff in the car. They wipe down their steering wheel because there's wherever they're putting their hands.
Yes.
I mean, you're not going to put your lips or nose or face against the car, hopefully, unless you really like your car. But is that? I guess there's no going too far, but that's that's adequate, I guess, right?
It is, especially if when you got out of your car, what were you doing? Did you grab the doorknob of the person's house? For our home health people, they grabbed the doorknob and went in, and then when they return, when you pump your gas, how many people have grabbed that gas handle before you, and then you get in and you touch your steering wheel?
Yeah, that makes sense.
Not a bad idea.
That makes a ton of sense. I hadn't really thought about grabbing the gas handle, and upon thought, you'd think, well, does gasoline? Surely gasoline kills the virus if somebody gets a little gas on it.
I haven't seen any proof of that. I would hope so, but hopefully we're not putting gasoline on the handle either.
Well, yeah, accidentally sometimes.
Yeah.
The key, though, really is just cleanliness, staying away from people, staying away from people.
Absolutely.
What are you finding in compliance? Are you finding, like are folks staying away from their, family members are very difficult to stay away from, like your mom. My mom lives 3 blocks away, and I haven't seen her for a couple of weeks.
Right.
But of course, that's not all the ordinary. That's all it is too. I love my mother. But are you finding folks whenever you talk to people? Are you finding a lot of folks are being good about complying with rules, or most of the people you talk to, like me, maybe not realize how important they need to go?
Well, I want to applaud, first of all, our long-term care facilities and assisted living centers. They closed to visitors right away.
Weeks ago.
Yes. And they've been innovative, allowing a family member to stand outside. And I even saw, I think it was the Flora Healthcare Center, allowed their residents, they wrote on a whiteboard and then they put it on Facebook and let people comment to them so that they could have some discussion with the outside world. I think that's fabulous. I don't know about compliance otherwise. The most discussion we're having is over the executive order and what is and is not an essential service.
And you're talking about the executive order from the governor.
Correct.
I haven't really had one from the president just basically
on this
keeping.
Specific.
Yeah, specifically.
So this is the one that was issued last week, and there's a copy of that on our Facebook page with a direct link so you can go and look at it, because the list is long of what is considered an essential service. There are some manufacturing entities who may have decided that they are an essential service and others that have decided they are not, and employees being concerned about going to work. Our concern is when you get a large number of people in a group, quickly you can imagine if it's a large employer,
Yeah.
even 100 people.
Right.
If there is an outbreak amongst 100 people,
How
at the
quickly
health
that
department,
can-
yes, at the health department and at the hospital, we don't have 100 beds. And if we have to do contact tracing, meaning we
Right.
have to talk to everyone they've been in touch with, we're at capacity in an hour.
Yeah.
So it is so important that they adhere to those guidelines. If you have a concern about that, you can call the Department of Economic Development and Community Opportunity. The phone number will be posted later on our Facebook page. I just received that this morning.
Okay.
For people who have concerns about a business and think that they might not be an essential service, they can contact them for further guidance.
Tell you what, let's do. That's great. That's great information. What we're going to do, we're going to take a final break. We're going to come back. We're going to give you numbers who you can call for more information. Plus, we try to see if it's difficult to predict the future, but we can kind of think upper lower thoughts, right? I mean,
Yes.
let's the way we can try to keep it, and also what could happen. You're watching Big Talk with Bruce Dickey, and we'll be back right after this word. Do stick around.
When you want an honest deal and hometown service without the runaround, go to Lamont Chevrolet Chrysler in Fairfield. Let Gabe McGahey, Sheldon Bunning, Jeff Black, Dennis Downs, Matthew Rogers, or Caleb Dunn score the best deal for you on your next new or pre-owned vehicle. Parts and service departments with factory-trained technicians and express lane and state-of-the-art tire and alignment technology. Lamont always inspects your battery, antifreeze, wipers, and tires for free. We want you prepared for the open road ahead. Open 24/7 at LeMansOnline.com. You'll like the way we do business.
Get what you want and nothing else when you order a la carte internet from Wabash Communications. Wabash Communications is now able to offer a la carte internet called broadband only with fast download and upload speeds, reliable service, and unlimited data usage. No phone service is required for our broadband only plans. Our broadband only menu includes packages up to 1 gig download. Call us at 665-3311 now to order. Service availability and internet speed will depend on location. Contact us for details.
Hi, my name is Bruce Dickey of Wabash Catch TV's Big Talk with Bruce Dickey. Watch us each weekday right here on your local cable station. We're on at 9 a.m. with a repeat at 9 p.m. It's your local TV talk show with plenty of information, fun, and frivolity to get your day started right or maybe even ended right. Please contact me at 665-9970 or at bruced@wabash.net if you are a member of your organization would like to be a guest on the show. That's 665-9970. Big Talk with Bruce Dickey. Hey, thanks for watching.
At Wabash Communications, our goal is simple, to keep people connected. And today we are doing just that, better than ever, by delivering the latest technology and personal service only a local provider can offer. We offer services anywhere from fast, reliable internet, TV services, and home monitoring solutions to crystal clear local and long-distance phone service. Wabash continues the commitment we started back in 1952, delivering a great connection to the most important people we know, our customers. So choose Wabash, the local service from people you can trust.
Looking to build a new hobby building, horse barn, or farm shop? Let Morton Buildings help you design and construct a building that perfectly suits your needs. We'll be there for you every step of the way, even post-construction, with the strongest non-prorated warranty in the industry. Plus, Morton's exclusive Energy Performer insulation system provides the ultimate in comfort and efficiency. To see our latest projects and learn more, please visit mortonbuildings.com.
Hello, folks. Welcome back. Big Talk with Bruce Dickey here on Wabash Catch TV. We are talking today with Deena Mosbarger. She is with the Clay County Health Department. We're talking about COVID-19. Going to try to keep you healthy, try to keep you away from other people, try to keep you healthy as well as keep other people around you healthy. All right. This is, I walk outside every day. I have a maple tree, great big maple tree right in my yard. And right now it is popping off these doggone big things and just, I'm probably a week away from having the whirlybirds coming through the air. Another thing that goes with this, my head gets full as a tick. And I mean, I shake my head. Today it feels better, but some days I feel like I've got a big headache. At what point do I think, oh man, I'm sick, I'm going to die or something? But it's not. I'm not. I know I have allergies. I know. I don't feel. I don't. What's the difference between allergies or the cold or something in COVID?
And I think what the bottom line of that is probably, when do I call my doctor? When should I get worried?
There you go. Who should I call and when do I call?
Absolutely. So if you are feeling sick, you've got the allergy thing going on, runny nose. Runny nose doesn't happen to be one of the symptoms of coronavirus.
Okay.
But if you're mildly ill, and it can be addressed with Tylenol,
right?
It could include the cough, could include a low-grade fever, but you have some shortness of breath, but you're not having a lot of difficulty breathing. That's when you should isolate at home and continue to clean all of those frequently touched surfaces. However, if you can see that at the very bottom, I think I need immediate medical attention. Who should I call? Call your doctor or call the emergency room if you don't have a doctor.
Yeah, I was going to say not everybody has a doctor. So.
Absolutely. Or a medical provider. We have a lot of mid-levels that are seeing patients too. They're perfectly capable of handling these type situations. Call first and get some advice from them on whether or not they want you to come in, or whether they think that you should stay home, or whether they want to meet you in the parking lot. That's some good advice. They will decide with you whether or not you need to be tested for the coronavirus. Not everyone needs to be tested. If you have been around someone who tested positive for coronavirus, if they put you in the hospital, if you are in a cluster of folks, then you would need to be tested. Those people live in assisted living centers. Yeah. They are in nursing homes, and that way we would test a lot more folks to make sure that we're not spreading it there. If you have the symptoms, they will continue to treat you the same. They're going to treat the symptoms. They may be able to run the flu test. They may be able to do a strep screen, because what you are experiencing may be something different that is totally treatable.
Right.
Okay. One thing that was on the paper at the very top is when can you go back into the public, or when can you come out of isolation in your home? And it says when you should stay home for at least 7 days or 72 hours after your fever has resolved and symptoms are improving. And that's when you can start to get back out into your home with the other folks who live in your home, or getting out to do those essential things.
Yeah, that's the other interesting thing you'll see on social media. Folks who are who do have it are staying in their rooms and having food brought in, and they're not around people. And safety in the home is just as important as safety. Social distancing in the home, if someone is ill, is just as important, isn't it?
Absolutely, because who's going to take care of you if everyone in the household is sick?
Yeah.
So maybe you can keep some folks well.
Can I ask just throw a couple situations? If I know someone who has, say, all right, we'll call this hypothetical. And it is hypothetical because you folks find out other people have you find somebody with the virus, but you haven't been with them for, say, a week. At what point can I feel safe that I don't have it without going to get a test of some kind? Because the tests aren't available for everybody yet.
Right. We have been recommending, if you've been with someone and they were diagnosed, you should quarantine yourself for 14 days. If you haven't been with them for several days, you should go ahead and take precautions, but I wouldn't be as concerned if it's been several days. Now, we know that people can be, we call it shedding the virus, and my husband asked, what does shedding mean? Well, you know what it looks like when your dog sheds?
Right.
It gets everywhere.
Yeah.
And every time you turn around, oh, there's another dog hair. It's kind of the same thing.
Really?
With coronavirus, it sheds.
Yeah.
It sheds, it gets everywhere, you don't know where it's at. We know that you could be shedding the virus for 2 to 3 days before you have any symptoms. So there's not a written rule, hard and fast, that says, oh, I was with them 5 days ago, and now I'm safe. There's not a rule like that. You should watch yourself for symptoms and take precautions. Still, social distancing, wash your hands.
Wow, I'm just sitting here thinking, counting the number. I've got a friend who went to a conference, and there are people at the conference who have been diagnosed with and tested and COVID positive, but he has not. He's been away from them for now almost 2 weeks, and he has still shown no signs. He's self-quarantined though. That's the important thing, and that's what you kind of have to do, isn't it?
Yes, it is. You should self-quarantine and practice all of those things that we've been recommending.
Do we know the course of? Now, granted, we don't know what the course of the pandemic is going to take.
Right.
That's just too far out. We're in a how long? I guess you don't know, but I'm going to ask anyway. How long is this quarantining going to last?
Yes, I have no idea. I know that in Korea, they dealt with it differently than in, say, China. South Korea has dealt differently than China, and they've had more tests available. And I do know that they are starting some activities outside again. They're having sporting activities. They got baseball. Baseball has started up. That's the only reason I know that. I pay attention to baseball. But at what? I guess my question is, when do we see a light at the end of the tunnel? We're still in the tunnel, aren't we? Exactly.
How deep into the tunnel are we?
I don't know how deep we are, and I know the president and all of those people who are at a much higher pay grade than I are watching the way different countries have handled it.
Yeah.
And they're doing research and making recommendations, and I think the answer to that is it depends on how well we do this. If we social distance and we follow the guidance that they're giving us, we have a much better chance of ending this sooner. If we don't, if we continue to buck the system in different ways and don't follow the guidance that's been provided, this could go on for a while, and we could see those numbers of both cases and deaths increase.
And that's the thing. This is maybe not the easiest thing to whip, but it's something that we need to.
Yes.
And just keep that in mind. Keep in mind every time you do go outside that you don't want to get somebody else sick. I mean, for the sake of your fellow neighbor, your fellow countryman, your fellow person in your community, you don't want to get anybody sick.
No.
Right?
That's absolutely right.
Social distancing. Well, if you had, we've got 30 seconds here. If you had one or two things you wanted to say about being about where we are currently, what is your main emphasis? Social distance.
Social distancing. Stay home. Wipe off your counters. Disinfect. Wash your hands often, and call your provider if you have severe illness.
Do we know? I'm going to ask this. This is also hypothetical guy. Made a big pot of vegetable soup over the weekend. Huge pot of vegetable soup. And it boils. Mm-hmm. But I am also one of those awful people who will taste. And I don't use a separate spoon to taste. It has boiled since then. Can I take some of that to my mother?
You might want to ask your mother. I'm not sure what kind of cook you are.
I'm a great cook. I didn't bring any of it to test, but
Right. I would say that's not a good idea anytime to be double dipping and sharing.
there you go. See, I've learned my lesson. I thought about that after I'd already made half the soup and I'd been tasting it. Oh no, I can't give this to anybody. And so I got to keep that on my doggone. I have to eat all my vegetable soup. That's too bad. Thank you again, Deena, for coming on here today. I really appreciate it. Let's make sure folks stay healthy. How's that sound?
Absolutely.
We'll see you all next time on Big Talk with Bruce Dickey. Have a great day.